Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Please subscribe to our Scripps Health YouTube channel. We've got great videos featuring the latest technology, our stellar doctors, and inspiring patient stories. Caring for the LGBTQ community. According to the Centers for Disease Control and Prevention, members of the LGBTQ community are at increased risk for a number of health issues. HIV/AIDS is the one that's most talked about, but there are others. Here to talk about it are Dr. Brian Kim, who is a family medicine doctor and HIV specialist with the Scripps Coastal Medical Center in Hillcrest, California, and Dr. Manish Champaneria, a plastic surgeon at Scripps Clinic in Del Mar, California, who specializes in transgender surgery. Thank you both so much for joining us.
Thank you for having us.
So what are the everyday health issues that affect the LGBTQ community?
I think some of the everyday issues are pretty similar to the general population, but there's definitely some unique needs. I think STD prevention is very important, STD treatment.
STD is?
Sexually transmitted disease. HIV prevention, HIV treatment.
HIV and AIDS now is really become not something that you necessarily pass away from. It's more of a chronic disease that you live with.
Yes, I mean, thankfully, with the evolvement of more newer antiretrovirals, we're really not seeing the death sentence that we used to see in the past. It's become more of a chronic disease, very manageable. A lot of our patients have very normal lives. I mean, there's still some challenges with HIV. It's seen more as like a chronic inflammatory disease. There's increased risk of cardiovascular disease and more premature aging with HIV. But besides that, it's come a long way.
And so go back and talk about the other issues that affect the LGBTQ population.
The other LGBTQ issues, so there's some vaccinations that are different. We're more proactive about screening and preventing hepatitis A, hepatitis B in the gay population. In addition, we do vaccination for meningitis because there have been some outbreaks in the gay community, so that's something that's a little bit different. Cancer screening is a little bit different. So for the gay population, we have discussions with them about anal cancer screening. That is very controversial right now. There are some proponents in the LGBT community that do anal pap smears or just plain anoscopy during physicals, for example, almost like when women get a pap smear.
And then what about the transgender community?
Well, for our transgender patients, I think they have unique needs as well. I think they need a multidisciplinary approach to their health care, and sometimes access can be a problem. But once they find the right physicians and the right practitioners that can help prescribe their hormones, can help them with their mental health, and finding the right surgeons, I think that will really provide them the best care possible.
So it's a big team approach.
It is a very big team approach, definitely.
As these teams kind of just start forming spontaneously over time, we start getting to know who we are. Like I started to get to know Dr. Champaneria as a surgeon, so now we work together a lot. We share a lot of the same patients. There are a lot of mental health providers that refer to me for hormone therapy, and so therefore I refer back to them, and we all start knowing who we are. So we start becoming our own community in that way as well.
Well, how often should you get tested for HIV and sexually transmitted diseases?
As frequently as necessary. So I think the guidelines say for gay men they should have STD testing at least annually. But you know, a lot of our gay patients, they take PrEP. And with PrEP you do...
What is PrEP?
PrEP is pre-exposure prophylaxis. So it's a daily medication that's taken right now to prevent HIV. And so we do more regular STD screening with that every 3 to 6 months. But we have some patients where if they're at higher risk, they can just call us and ask if they can get tested because, you know, the risk just really depends on, you know, when exposure might happen to a sexually transmitted disease.
And how effective are condoms?
Condoms are very effective for some, but not all STDs. For example, the STDs that are spread mostly through body fluid, like gonorrhea, chlamydia, HIV, condoms are very effective at prevention. But there are some STDs that are spread through skin-to-skin contact. So things like herpes and genital warts may not necessarily be prevented through condom use because the condom won't, you know, completely cover the skin and provide a barrier in terms of that type of transmission.
And you say there's also a trend to not use condoms now with this new preventive drug?
Definitely. There is a rise in the number of STIs within our community because patients either by choice or through other various reasons don't use a condom. And so because of that, they don't have that skin barrier. And patients sometimes will just say they're on PrEP, and so they don't have that skin barrier. There is a rise of certain types of sexually transmitted diseases.
So even though they're taking this preventative drug PrEP, you still would advise that they wear a condom?
Yes,
Yes.
definitely, to prevent other STDs, and also because PrEP is very effective, but it's not 100% effective. And sometimes mistakes can happen, just like they can happen with birth control. Someone may forget their pill and then they end up getting pregnant. So it's always a good idea to try to be completely safe when you're talking about a chronic condition that is lifelong.
And PrEP doesn't treat herpes or gonorrhea or syphilis. It's mainly geared towards HIV.
In a couple of minutes, we're going to talk about the psychological issues that face the LGBTQ community. So hold that thought. We'll come back to that in a couple of minutes. Talk about HPV, throat cancer, prostate, testicular cancer, colon and anal cancer.
So a lot of the cancers are screened very similar to in the general population. For example, prostate cancer, we have the discussion with all patients, usually at age 50, the pros and cons of screening. It's no longer really the standard of care to do it automatically. Colon cancer screening is the same. There's potentially higher rate of throat cancer in gay men. There might be more HPV acquisition that occurs during their lifetime, but for now, there's no screening done for it either in the general community or specifically the LGBT community. For anal cancer screening, that's very controversial. But some options are to do anal pap smear or just a plain examination during the physical. A more specific exam called an anoscopy, where you're able to look at the lining to see if there's any concerns of any pre-cancer or cancer.
And what about the issues facing lesbians?
The issues facing lesbians, there's believed possibly to be a slightly increased risk of both obesity as well as some breast cancer and possibly ovarian cancer. The obesity we feel is multifactorial. There might not be as many pressures to attain a certain appearance in the community. In addition, we think because there are slightly higher obesity rates that there might be more increased risk of estrogen-dependent type cancers, because obesity and increased body fat can increase estrogen levels. And so the screening is the same for breast cancer, but we try to make sure that we stay on top of that. For ovarian cancer, there's less use of birth control pills. So there's a little bit more risk because birth control pills can be preventive. So the lesbian community just in general tends not to use oral contraceptive as much unless it's for treating a non-contraception type condition.
And what about the health issues facing the bisexual community?
Yeah, so for the bisexual community, I think I kind of tailor the care towards where they are on the spectrum. There are some people who are kind of more towards the hetero side, some people who are more towards the gay side or the lesbian side. I think the other thing that's also important is to just really recognize and try to validate that perspective that they have, because a lot of times in the LGBT community, they're not recognized. They're recognized as being in transition towards one orientation or the other. And so sometimes they might just default to just being, well, I'm just going to be what people want to perceive me as. And sometimes I find out that some of my patients are bisexual when I never even knew, and I thought they were straight. So.
And then what about the health issues facing the transgender community?
I think the transgender community has a specialized set of issues that they have to deal with. One of them is gender dysphoria.
Which is what?
And gender dysphoria is feeling depressed or anxious about the gender that they were born into, but they identify with another gender. So these patients can feel lonely, they can feel anxious, they can feel depressed. And so seeking the correct care for that, meaning seeking a mental health professional, a social worker, a psychiatrist, even a family medicine doctor as well, and getting counsel for that.
And then your specialty is transgender surgery. So what does that involve?
So my specialty is transgender plastic surgery, and that regards helping the patient reach their physical ideal in their gender transition. So for certain patients, that involves top surgery. And top surgery basically means a mastectomy for my female to male patients, as well as breast surgery for my male to female patients. So either creating a masculine chest appearance or a feminine chest appearance. Other aspects of gender confirmation surgery is facial feminization as well. So that basically involves restructuring different parts of the face to make it look more feminine.
So who is a candidate for transgender surgery and who is not a candidate for it?
Most of the patients who are undergoing a transition are candidates for transgender plastic surgery. There are certain guidelines that are given by the World Society for Transgender Health. Typically, those patients have to be living in their gender of choice for 1 year, and also have a letter of approval, basically, from a mental health professional, letting different surgeons, different people, letting the insurance know that they are ready for surgery and are good candidates for surgery.
And what are the risks to this surgery?
You know, the major risks include the typical surgical complications that could happen. So bleeding, infection, sometimes there's asymmetries. Sometimes if we do nipple grafts for our transgender top surgery for female to male patients, those can have issues as well. But just the basic surgical complications could potentially occur, but they are rare.
And then after you've had this surgery, let's talk about hormones and the risks that taking hormones over a long period of time poses.
Definitely. Some of my patients actually don't take hormones, and some of them undergo this process without the hormonal therapy, but oftentimes they're seeking counsel with an endocrinologist who is prescribing their hormones. For me, as a plastic surgeon, I don't have them come off of their hormones, and I have them continue throughout their process.
But the increased risks would be?
The increased risks, I mean, these are mostly theoretical, because when we're treating with hormones, we're really just aiming for the physiologic levels of the goal gender that the patient has. So for example, for testosterone, their testosterone does make the cholesterol worse, and also it can cause the blood count to go up. So some people, if they go on too much testosterone, they can get a rise in their blood count, which can actually predispose them for getting blood clots or any kind of thromboembolic phenomenon. So for estrogen, there's risk of getting blood clots as well. But again, the doses that we use are, very physiologic, so we don't tend to see them too much.
Is there an increased risk for heart attack, stroke, cancer?
There's theoretical risk. It's hard to say if it's increased. We definitely don't subtherapeutically dose or do something that's different for, what's age appropriate for that gender. I do think when people are getting of age, then yes, these risks might go up as they do in the general population.
And then what about the injectable silicone for those instant curves?
I think in theory that sounds amazing to get an instant result, but I think that's actually quite dangerous. So there are other body contouring procedures that we offer that are more safe than injecting silicone. One of them is fat grafting, where we take fat from other parts of the body, process it, and then inject it again. So you're basically using your own body fat to give you those gentle curves.
And then what about the genderqueer population? Can you explain who these folks are and then the health issues that they face?
Yeah, it's there's a lot of words for it, but genderqueer, it represents, maybe the more general term is gender non-binary, so people who do not completely identify with a male gender identity or a female gender identity, but somewhere in between. And again, people are all over the spectrum, and with hormone treatment for that population, we just kind of see where they want to go, and again, keep their treatment appropriate, but if they want to fully try to transition towards the opposite of their assigned gender, we take them kind of where they want to.
Let's talk about family planning issues for the LGBTQ community.
Well, LGBTQ, they can have children just like anyone else. There's different ways that are pursued. So for gay couples, simple adoption or doing a surrogacy type pregnancy where they get a donor egg. For lesbian couples, intrauterine insemination, that's an option. For transgender, it's a little bit more tricky because depending on where patients are with their transition, it can make pregnancy difficult or being able to have children difficult. So a lot of times for trans men, they need to consider whether or not they need to preserve oocytes or to preserve their eggs before they go through hormonal transition, because fertility might decrease. And of course, if they decide to do bottom surgery or to have a hysterectomy, then that will make pregnancy impossible. For our trans female patients, again, they might want to preserve sperm before they go through hormonal transition, because hormones will suppress their ability to make sperm.
So we've talked an awful lot about, the physical issues that face this community. Let's talk about the psychological issues. Let's come back and talk about this, because there is a lot of depression and anxiety and loss of emotional support and isolation. And isn't there also a higher incidence of suicide, because a lot of people still have to deal with the stigma that some people heap on the LGBTQ community?
Yeah, it's unfortunate, despite all the progress that we've made and how welcoming people are, that there is still a lot of discrimination. A lot of people still live in the closet, especially while they're still young, and there is increased depression and anxiety in that community. So it's something that we definitely pay attention to when we see our patients, to check in with them. People who are actually the happiest are the people who have completed their process of coming out and are able to kind of live the lives that they wanted to live. We actually see more of the issues with people who have not been able to because of fear of, discrimination or rejection.
And as far as the transgender community, when you talk about doing the transgender surgery, your first response was, let's make sure that psychologically this person is ready for this.
So surgery is kind of at the end stage of that. It's not the first stage. And so the physical manifestation of plastic surgery should happen after they are getting treated for their loneliness, depression, anxiety. And so the transgender patients definitely need access to mental health professionals, as well as need good treatment as well.
Is there an age that you recommend that someone should be open about their sexuality with their doctor?
I think that age can vary. I think there's no exact number that we can pinpoint as practitioners. As early as possible, but the patient has to be comfortable themselves with their own sexuality, definitely.
Yeah, and I think there's a difference between, gender identity versus sexual orientation as well. A lot of our transgender patients, they feel it when they're as young as they can remember. So, there is a lot of discussion nowadays with parents, especially in pediatrics, to kind of sense and check in with their children about that. And if that's the case, even treatments are done, before puberty as well.
Is it important to seek out a doctor who is part of the LGBTQ community?
It's helpful. I think that, patients definitely feel more comfortable, but I think what's important is just knowing that your doctor is open-minded and open to learn if they don't know.
Yeah, I definitely agree with that, with what Dr. Kim says. I think you should find a physician, a doctor who you trust and that you can openly and honestly discuss your issues and concerns with. It would be great if they are a part of the LGBT community, but that's not a mandatory requirement. Just make sure that you're comfortable with whoever you seek care with.
Any final thoughts?
I think it's an exciting time in the LGBTQ community, especially with regard to healthcare. There's a lot of new trends and new treatments that are available, and our goal is to help strive to make them feel better and more healthy.
Is there anything that you would like to say to your patients or to your prospective patients?
Yeah, as Manish was mentioning, LGBTQ healthcare is really evolving. There's a lot of changes, new treatments. A lot of this we're learning as we go along. And so I think that, if you're going to see your healthcare provider, if they're really knowledgeable, that's great. But if they're not, be willing to open up and teach us, because I think that we're all learning this together.
Thank you both so much. We appreciate your time.
Thanks.
Scripps has been repeatedly honored for its inclusionary, compassionate care of the LGBTQ community. If you would like more information on caring for the LGBTQ community, please click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. I'm Susan Taylor. Thanks so much for joining us. It's our mission at Scripps to help you heal, enhance, even save your life.